My name is Perry Walker, and I'm a speech therapist, and I've been a speech therapist for 25 years, and I've been with children's therapy for 12 years. And I'm here to talk about oral motor skills specifically to increase chewing. A lot of kids that we see, a lot of families that come in are very concerned that their children are having trouble transitioning from puree to more solid foods. So I'm here to talk about a very specific program that we use here at Children's Therapy Center, and it's referred to as the chewing hierarchy. And this was developed by Lori Overland, who is an oral motor feeding specialist with Talk Tools, which is an organization for oral motor development and skill building. And this is something that we all use. Speech therapists around the world always refer to the chewing hierarchy. And what's important about that is the goal of this hierarchy is to teach a graded lateral chew with tongue tip isolation and movement across midline. Basically, that means that your tongue can move forward and side to side because it has to move all that food around. So this chewing hierarchy is going to help you with that. Think about how you're chewing the next time you eat. Not only do you need to move your jaw to chew up and down, you also need to move your tongue all around to move the food from side to side. With the chewing hierarchy, there are 4 steps. If your child is already eating, you can use foods such as a veggie stick. Today, I'm going to demonstrate the chewing hierarchy with what we call a Z-Vibe, which is an oral motor tool that allows children to chew and bite without food, without the risk of choking. So let me make sure I'm on the right step here. Okay, for step 1, you want to place the tool or the food perpendicular to the back molar or the molar ridge if your child doesn't have teeth, right here. And you want to push up and down, or first you want to push down and then push up and down to facilitate chewing. This will send the brain to the message that there's food on that back molar, and this helps you practice chewing. And you want to practice 2 or 3 times and alternate each side. And do this 4 or 5 times, back and forth, as long as your child will tolerate. That's step 1. Step 2, you want to place this tool or the veggie stick on the lateral incisor and then quickly move it to the back. And do this on each side 4 or 5 times. This will start getting the tongue tip forward and moving that tongue back to the molar ridge while you're practicing chewing. Step 3, you want to present the tool or the veggie stick on the lateral incisor and encourage your child to bite down. Then quickly move it to the opposite lateral incisor and have them bite down. Do this as many times as the child can tolerate. We usually recommend 4 or 5 times, alternating each side. This is similar to step 2, where it helps the tongue move forward, the tongue tip, and then move back to the side. So you're chewing and moving your tongue at the same time. Step 4, the 5-point bite. You're going to present the tool perpendicular to the molar ridge and have your child bite down on the lateral incisor, bite down in the front, opposite incisor, and back on the other side, the molar ridge. And you can do this 2 or 3 times, going all the way back from side to side until they are biting down independently on each of the points. After you've practiced the chewing hierarchy and you feel like your child is chewing pretty well, now you can introduce foods. We always talk about cubes and strips. When we talk about cubes, you want to have a soft food such as cooked carrots, baked potato, avocado, soft cheeses into a small pea-sized cube. For today, I didn't really have a cube, but I'm going to use a yogurt meltable. The Gerber graduates are really good, anything that melts. And you want to place it directly on the gums or the back molar. Does this sound familiar? Step 1 in the chewing hierarchy. So you put it in the back and they'll start chewing. Tongue's going to move around and then swallow. One good thing about putting the food in the back versus the food in the front, children still have a little bit of the tongue thrust when they're learning to chew and swallow. the food comes out more likely in the front. If you put it in the back, it's much less likely to come out. So we always talk about foods in cubes. You can cook your potatoes, cook your carrots, make them soft, cut them up in little cubes, and put them towards the back, and that will really facilitate chewing. And then we talk about strips. One of the most famous strips, Veggie Sticks. Now, I cannot demonstrate eating this because I have food allergies, but it's the same concept. It's great. They can hold it, and you can show them at first, but I'm telling you, the kids pick up so quickly. They just put it to their back molar, they bite down, they chew, they swallow. Veggie Sticks are great. You can, the cheese puffs that melt in your mouth. You can have waffles and cut them in strips and they can hold them. The key is putting it in strips where they can hold and place it in the back molar ridge and bite down, chew, and swallow. And if you have concerns about their chewing and swallowing safety, I would recommend you going to your pediatrician or physician to get a referral for a speech language feeding or oral motor evaluation.